A very provocative presentation at ASCO 2017 was done by Dr. Ethan Bash, who was previously at Memorial Sloan Kettering for many years and then recently moved to the University of North Carolina. This abstract was featured in the plenary session of the ASCO conference, really highlighting that this was one of the most important presentations at the entire meeting. And what makes it especially interesting is it wasn't about a fancy new and expensive targeted therapy or immunotherapy. It was just highlighting the value of better patient communication. Now, this was a study of over 750 patients at Memorial Sloan Kettering, treated over several years. These patients had any of many different kinds of solid tumors, and they were randomized to standard good follow-up in the cancer clinics at Memorial Sloan Kettering, or the same approach, but with the addition of a weekly feedback using laptops or tablets or smartphones, etc., just to give constant feedback about potential signs and symptoms that patients could be doing worse. Things like fatigue, nausea, weight loss, etc., as red flags. And in 3/4 of the occasions when people reported things, this led to the nurses who aggregated this information doing something with that information, and that led to better outcomes. Now, it's perhaps not surprising that patients had a better quality of life when they had better feedback about their symptoms, but this actually led to an improvement in overall survival, and not just a small one. It was a 5-month difference in median overall survival, and it was translated by an improvement in the prolongation of time that patients were on chemotherapy by a couple of months. So presumably, if patients were having difficulties on a given treatment, they could have refinements of dose and stay on it for longer, and this might have been one of the many mechanisms that led to better results. In fact, it's not an isolated result either, because Dr. Denis and colleagues from France reported on a study in ASCO 2016 that looked at better feedback in lung cancer patients with stage 3 or 4 disease, and just whether they had worse symptoms and needed to get more frequent scans or other refinements, and this also led to a significant improvement in survival. So this really seems to be a real finding, a reliable trend, that the patients who have better communication clearly do better. And I think it's going to be very important in the coming years for cancer centers to integrate these communication tools to make patients a more active member of the care team, not just to make them feel better and not just to improve quality of life, which is important, but to actually have them do the best they can and live significantly longer.